index finger and the middle finger, I go like this. Here. And now I'm in the muscle. And he feels it. So I will show you the whole palpation protocol from the course. This is the only whole palpation protocol because you cannot do safe dry nailing without this. How will you find Quadratus Lumborum? When you palpate any muscle in any part of the human body, you will always use the function that only that muscle does in that area. Which function does only Quadratus Lumborum do in lumbar area? Which movement? Elevation. Yep, elevation of pelvis. Neither muscle of these is doing elevation of pelvis. You always want to use, this is the movement of quadratus. Every muscle in the human body can shorten in one or the other direction. When the quadratus is shortening in this direction, you will do lateral flexion. But when it's shortening in this direction, you will do elevation of the pelvis. So you'll always use the movement which only this muscle does in that area because you will only get contraction from it. What is the important thing here is that Quadratus Lumborum is just under the erectors and it's really hard to palpate it because of that. How will you find it? First, you will find crest iliac here. Look at how high his hips are when you palpate. That's why you need to palpate with everybody. Second, you will find the 12th rib. Look how narrow a space in this big of a guy you have between the crest iliac and the 12th rib. You would never say that it's this narrow in this big of a guy. Why do you need to find that space? Because this is the only safe space to do Quadratus Lumborum. When you are in this space, you will find erectors. The lateral part of the erectors. How will you confirm it? Please do the extension of your core. Okay, here you go, relax. I confirm that I'm just on the lateral part of the erectors. After this, I will put my thumb under the erectors because that's where Quadratus Lumborum is. And I'm here under the erectors. Now I will ask the patient to do the movement of the elevation of the pelvis. Not one patient will know how to do it. He knows because he's colleague. How will you show your patient to do elevation? Like this. Look at my hip. My hip is going to my shoulder. Always show them in the standing position because it will be hard for them to understand that movement because it's not natural movement to do elevation of the pelvis. And always tell them you need to move your hip to your shoulder. Please do the elevation. Here I can feel contraction. How will you feel contraction? A little bit of a muscle will push your finger out. And after you will tell him to relax, your finger will go in. Please do the contraction. My finger is out. I feel the contraction. Neither muscle besides Quadratus Lumborum here can do elevation of the pelvis. So this is really important to do this movement. When I'm here, my needle will go under the erectors in this way. Here we'll puncture needle directly under the erectors and it will go like this. If his Quadratus Lumborum is more down, you will go more like this. You need to be careful because you cannot go like this in any point and you need to be sure that you are in the middle of crest iliac and the 12th rib so it is safe. So we will just go under it. So erectus, just under it, we go to the quadratus. We're here. Please do one more elevation. It's a little bit more out. Relax. One more. Okay, it's here. The needle is here. You will need a lot of depth here. Here we are. I go in this direction. And now, here I'm in the muscle. You will need depth. 7.5 centimeters is not enough for him. When you want to get depth, index finger and the middle finger, I go like this. Here. And now I'm in the muscle. And he feels it. This is the muscle that never ever somebody has treated to you because it's deep and it's painful. Quadratus Lumborum will cause lumbar back pain, sacroiliac joint pain, and gluteal area pain. And why is that important? If you fix paravertebral muscles and you do not fix Quadratus Lumborum tension, you will still have pain. And if you release everything here and you still have pain in the sacroiliac joint in the lumbar area, it's probably Quadratus Lumborum. And everybody forgets about him. Do not forget about Quadratus Lumborum. We are fishing it. 5 to 6 twitches or 15 to 16 punctures. And we can leave it 5 to 10 minutes, but in the most cases, if it's deep enough, the needle won't stay directly into quadratus. But you can leave it 5 to 10 minutes. It doesn't matter because you fished it the most. Are you alive? Yeah. After you leave it for 5 to 10 minutes, that's it. You here fish it, but in the same direction. Do not change direction of the fishing. Why? Just imagine the anatomy. You have the erectors, you have quadratus under it. Quadratus is going from crest iliaca to transverse processes and to the lower part of the 12 rib. And it's under it. So we need to go under the erectors to hit it. But you need palpation protocol because for someone it can be more down, for someone it can be more up, and you need to hit it directly.